Hi, welcome to Break Time with Brakeman. I am here today with two of our newest members who are bargaining their first contract right now with UAW Local 7902. I have Donna Freeman-Tweed, who is a physician assistant in the student health employees at the new school bargaining unit, and I have Lupe Larez, who is also a physician assistant, and they're both here today to talk a little bit about what is happening in their first bargaining. There's some significant challenges they're having. And why don't I start with turning it over to you, Donna? You want to talk a little bit about what's going on and also talk about why you all wanted to form a union and why the furloughs right now are particularly dangerous.
Right. So we are the professional unit at Student Health Services. I mean, we have our support staff as well. So that's how we, distinguish ourselves. And we are medical service providers and mental health service providers. And the middle of March is when we were all sent home. And we started doing telemedicine at that point, but then received a letter or notice saying that some of us will be furloughed, and because we cannot do our work from home. That was the number one reason given, that we can't do our work from home. So most of work, yes, that we were doing, exactly, that we were doing from home, and so most of us were furloughed. There are a few mental health providers that are remaining to carry the load, which is going to be tremendous for them, given what's going on with COVID right now and the death of George Floyd, the total unrest and lack of leadership in our country, right, to calm us down. So the reason why we decided to unionize was because we felt our jobs were in jeopardy. We felt strongly that the new school needed a student health service to help our students, that the students needed us to help them get through their careers, get through their time at the new school. So this is why we unionize, so that we can be there for our students, both for us and for them as well.
Right.
And this is why we unionize. And we've had a very difficult road. It's been over a year. And I feel like we're nowhere close to, signing a contract at this point.
Yeah, no, I understand. Yeah.
Lupe, do you want to say something?
Oh, okay, yeah. Just to add to some of what Donna said, so the reason that we unionized is that in the past 4 or 5 years, I've been at the new school for 24 years. And in the last 4 or 5 years, it's been, repeatedly having to prove our worth to the administration that is currently their upper level management, that repeatedly we've been, threatened with outsourcing and subcontracting, and we just wanted more job security. And also people who are uninformed, unlicensed, untrained as medical and counseling professionals were telling us how to do things, how, setting health policy for us. And that had never, ever happened before. We had autonomy. We knew what our students need. And we have very good leadership, direct leadership. Our supervisors are excellent. And we provide a very good service in both medical and counseling. And we collaborate with each other. And with other student health and taking care of college students is not just, counseling and medical. We work with other parts of the university, the advisors, crisis management, health and wellness, disability services, housing, you know, everything to ensure the success of our students.
Specialists.
And then we also refer to specialists in the community when we need. But our students have come to rely on us as their primary care provider, and we provide year-round services to them. But now that was threatened, so we decided as professionals to unionize, and it's been going on for about a year, over a year, and so we were working remotely and doing very well. A lot of students who were international students were, because of travel restrictions, found themselves here isolated with no family and no one, you know, and separated from their from all the other college community because everybody went in their separate ways. So they really needed us, and they really do continue to need us. Plus, you know, we were taking care of students all across the country and the world. I had students in California, Colorado, Vermont, and they were at their parents' home, yet they were calling us, calling me, you know, booking an appointment with us, and we were working remotely and doing very well. And then April 24th, the new president of the university sent out a letter stating that those that could not function remotely would be furloughed. So I didn't feel like it was us because we were functioning remotely, right? And as all other medical practices, right? That's the standard right now because you know who wants to go to an urgent care and ER and be exposed to COVID-19 patients? So the standard of care is telemedicine, telehealth, and telemedicine. I mean, telecounseling and telemedicine. So that's the standard, and that's what we were doing. And so they announced on the 24th that we would be furloughed. And so as of the 15th, after the 15th, we would no longer be providing services. Now, the student health services falls under an umbrella of enrollment and success. And out of like near 300 workers, our unit was the only unit to be furloughed. You know, our, I think 9 counselors and 6 medical staff were furloughed, including the assistant vice president of the student health service, the medical director, and the 7 administrative support staff. The 3 of the 4 counselors that were left, 3 of them have not been employed at the new school, not even 1 year. So they kept the newest employees.
Well, yeah.
Right, So, and yeah, you want to say, Donna?
Yeah, I was gonna, no, yeah, they kept the newest employees, and we have an externship program with the psychology students upstairs. So they come downstairs to get clinical experience. And when everyone was on board, it felt evenly distributed, the number of externs to employees, to healthcare professionals. Now that it's fewer counselors that are left, they have had to reorganize the externs, and some of them may have as many as 4 to 6 externs who have their own patients load, plus the counselors with their own load. So it's very overwhelming for them, you know. And as we know, during this time, the need for counseling has tremendously exponentially risen, you know. So we are very busy in that department.
Yeah, each counselor has their own patient load, plus they supervise 3 or 4 externs that have their own patient load. But when they furloughed 9 of our therapists, it left 4 people doing the work of 15, right? Or whatever it is, the people that see 12, 13. So for the people who are remaining, it's a big stressor and a lot of responsibility.
Yep. So tell me, before we finish up here, because I know we could probably talk much longer, but we want to keep this to a time period that people will really watch.
Mm-hmm.
What do you want to say to people who might be watching this, like at the news or whatever? What do you? Let's end on, what do you want to happen? Because it is dangerous during these times that you're not available to.
Yeah.
To the
Well,
community.
the staff put together a petition and addressed it to President McBride, and we asked for a meeting, and so did the students, and we collected hundreds and hundreds and hundreds of signatures. I don't know, maybe between the 2 of them near 1,000, but I'm not sure. Do you know, Donna?
It's probably over 1,000 by now.
Over 1,000, and we have yet to hear anything. We have yet to hear. Now, the Student Health Services is under enrollment and success, and annually they have a budget of probably $9 million, and that includes the the budget for our department, Student Health Services, and the students pay a services fee that covers them until August 19th. So we want to go back. We want to go back and provide services to our students. Our students need us. 1, we want the furlough to end. And 2, we want our retroactive raises. When we started forming the union in 2019, they withheld our 2019 retroactive increase, right? Or increase for 2019 and for 2020, saying that we would get it at the signing of the contract. Well, in January of this year, we gave them our wage proposal and increase, increases proposal, and they started even before the pandemic saying, we're in a deficit. It started with a $3 million deficit, then it was a $7 million, $8 million, and when the pandemic came, forget it. And now they're preserving their cash reserves, and not wanting to give us any of our retroactive increases. So we want our retroactive increases. We don't want them in 2023 or 2022. We want to go back to work. We want to go back to work and see our patients who need us, who really need us.
What about you, Donna?
Well, yeah, I would love to sit down and speak with President McBride, to figure out how this decision was made. I think it's untenable in this time to totally furlough all of medical, services. We offer services to the students that, for them, it's very hard to go outside of us and get these services, especially with people that they don't know. And so we know our students very well, and students are still writing me, even though we're furloughed. I'm still getting emails, and I can't take care of them the way I used to, and I want to go back to work, and I would love to sit with and talk with President McBride, and I want what's due us, or retroactive pay, but mostly I really do want to go back to work and help the students through this time.
The type of service that we give is not easily transferred to any corner, medical practice. We provide transgender care. We provide PrEP, pre-exposure prophylaxis for HIV, post-exposure prophylaxis for HIV. A lot of conventional, traditional practices don't provide this. So we do, and our international students really need us. They really do.
Yeah, I was going to say two things with
Yeah.
and then we should wrap it up. The
Mhm.
tuition that students pay to go to the new school would justify it. Minimum, you would have this service, and yeah, you have such a high percentage of international students who probably you're a lifeline for many of them. So
Yes, they rely on us. They depend on us.
with college-age daughters, I can certainly vouch for the importance of having these types of services available.
Yeah.
So I want to thank both of you for joining me. And I know the region has been involved in political pressure, and maybe it's a time to give President McBride a call, huh?
Yes.
Yeah.
Yes. Yes.
Okay, thank
For your
you.
time today.